Thank you for joining us in today's health segment. I'm Darian Lawrence.
And I'm Abigail McSwain.
Bringing you your daily health news.
In today's segment, we're going to be talking about heart health and an illness that can affect almost any and everybody.
It causes around 3.6 million deaths a year, but it is still mostly overlooked.
This illness is called hyperlipidemia, but it's more commonly known as high cholesterol.
High cholesterol is caused by high levels of lipids, aka fat, like cholesterol and triglycerides in the blood. This condition puts you at higher risk for heart attacks and strokes because blood can't flow easily through your arteries.
Hyperlipidemia is an excess of cholesterol. Some cholesterol in the blood is useful. It helps break down food and make hormones, but cholesterol is also found in most foods. So, when the body makes the cholesterol that it needs, in addition to the unnecessary cholesterol from food, it can lead to many heart problems.
Some common causes are smoking, drinking too much, eating fatty foods, not being active, stress, or just genes that give you a predisposition to cholesterol issues. Most times, people with hyperlipidemia don't display symptoms until it's too late.
Because high cholesterol is mainly asymptomatic, regular blood tests and lipid panel tests are crucial to determining if someone could be at risk. Plaque buildup can affect all organs, but mainly the heart and the brain. The plaque blocks blood flow to these organs and can affect the blood supply to the stomach, legs, and feet. When the blood to the heart is obstructed, it can cause chest pain called angina. This indicates a disruption in blood flow, and it can signal a risk for a heart attack.
Certain traits like age, sex, and family history can indicate your likelihood for high cholesterol. People with the family history of high cholesterol are more likely to get it themselves. This just means they would need to get checked more than others and play offense to manage the levels themselves.
As we age, your body's ability to clear cholesterol from the blood diminishes. This means the older you are, the higher your risk is for heart diseases and stroke. On average, women have lower levels of bad cholesterol until menopause. After that, the levels start to increase, putting them at a higher risk. Men have higher levels of HDL cholesterol than women at any age. This is the good cholesterol that filters out the bad. Like all diseases, there are treatments, and all treatments have benefits and consequences.
Most often, simple lifestyle changes can help decrease the effect of high cholesterol. Some of these changes are exercising, quitting smoking, sleeping at least 7 hours each night, keeping your stress levels well managed, losing bad weight, no longer drinking alcohol, and eating healthy. For others, it might not be this easy. Some people have to start medication to help manage their hyperlipidemia. The most common medication is statins. Statins are a type of medication that decreases bad cholesterol in the body. If you can take a statin, your healthcare provider might introduce another medication in addition to it.
The benefits of statins are simple. They lock enzymes in the liver in place to make the cholesterol in which we need and to remove the cholesterol from the blood that is not needed. And it could possibly help with dementia. However, the side effects and the consequences are way worse. Side effects include muscle pain, digestive problems, and mental fuzziness, and rarely, though not impossible, might cause liver damage. Muscle pains can be so bad that they stop your daily activities. People that often experience side effects at a higher rate were because they were taking placebo, which is another drug, but it doesn't have a serious effect. Another thing that can happen is inflammation in the liver and increased blood sugar or type 2 diabetes. Now that we have all the information on hyperlipidemia, how does it contribute to the heart disease?
Bad cholesterol is dangerous because it causes hardened cholesterol deposits to collect inside of your blood vessels. This makes it harder for your blood to get through, which puts you at risk for a stroke or a heart attack. The plaque itself can be irritated or inflamed, which can cause a clot to form around it. This can cause a stroke or heart attack depending on where the blockage is. Recent research on hyperlipidemia has led to several promising developments in treatment and understanding of lipid-related cardiovascular risks. Some notable advancements would be novel therapies for lipid management, genetic lipid disorders and understanding them, early risk assessments, and personalized medication for specific genetic conditions, like familial hypercholesterolemia. There are several health interventions currently available for managing high cholesterol. Some of these include lifestyle changes, medications, and in some cases, medical procedures. Dietary changes include reducing saturated fats, eliminating trans fat, increasing fiber, eating more healthy fats, such as those found in olive oil, avocado, and fatty fish, and incorporating plant sterols. Physical activity, weight loss, limiting alcohol, and cessation of smoking are also changes that can be made. Medical procedures are apheresis for individuals with severe high cholesterol who don't respond to medications, and in rare cases, surgical interventions. After learning this information, we hope that you will take precautions about what you consume and practice healthy habits so that hyperlipidemia doesn't take control of you. I'm Darian Lawrence.
And I'm Abigail McSwain.
Thank you for tuning in.